The CDC is confirming more cases of the polio-like disease, acute flaccid myelitis. And the rare but serious illness is mostly affecting young children. CBS 21's Chris Nallen talked with local doctors about the virus in this week's Doc Talk.
The following segment is sponsored by Geisinger Holy Spirit.
That we blame it on various viruses.
More specifically, enteroviruses.
Polio is also an enterovirus, and then there are non-polio enteroviruses. And then there is an adenovirus, and then there is a West Nile virus.
A whole host of viruses that could lead to acute flaccid myelitis. Dr. Muhammad Ali is an infectious disease doctor and raises the biggest question.
But we really don't know why it's happening in the community and why we are having these outbreaks.
Since 2014, the CDC reported an increase in cases, mostly young children. The virus is still rare but intense and attacks your nervous system. For instance, it could mean limb weakness and
sometimes the presentation can also be difficulty swallowing because the muscles of the face are weak, difficulty breathing.
According to medical records, most patients had experienced a mild respiratory illness or fever before developing acute flaccid myelitis.
You have these spots in the MRI in the gray matter of your spinal cord. And then sometimes at different levels.
What happens in the spinal cord then trickles to other parts of the body. As for treatment, Dr. Ali says there are two ways to approach this.
Supportive care in the hospital and then early physical therapy.
Followed by prolonged intensive physical therapy. Some cases, steroids are added to the mix, but there is still no specific treatment, and each intervention is a case-by-case basis.
No clear evidence that the experts will say that, yeah, in every patient you should do this.
Dr. Ali notes more research has to be done. For this week's Doc Talk, I'm Chris Nallen.